Let's talk this. It's an important topic, right? Pregnancy, we know it's a beautiful blessing, but there's a lot happening internally in a woman's body that may cause some serious complications without showing any signs.
Yeah, that's right. And we've heard of a lot of celebrities that have dealt with this, like Serena Williams, Beyoncé, and Kim Kardashian. They've all talked about their pregnancy issues and scares. So we brought in OB-GYN Dr. Wendy McDonald right now to shed some light on some of these complications. Thanks for coming in.
Thanks for having me, as always.
Yeah, so let's get it started with the first one, hypertensive disorder.
Yes,
did I say that right?
You did.
Okay.
High blood pressure in pregnancy is often this very silent kind of thing that can happen in pregnancy. You can have no symptoms at all, but actually, especially African American women can come into the pregnancy 40% more likely to start with high blood pressure, and then throughout the pregnancy have like 30 to 40% more chance of developing high blood pressure in pregnancy, and even preeclampsia, which is what Beyoncé had. There's a 98% more higher chance of having preeclampsia, developing that in pregnancy, and some people have no symptoms, but it can be life-threatening for mom and baby.
Does the high blood pressure go away after you have the baby?
It can, but sometimes it doesn't.
Why are African American women more prone to this? This happened to one of my friends.
It happened to me. It's one of those things that we don't always understand. We don't have the why, but we just know that that risk is higher, which is why regular prenatal care is so important, because it's something that we catch, which is checking your blood pressure and kind of monitoring your urine and that kind of thing.
Okay. Another one you're giving us that we need to be aware of is gestational diabetes.
That's right.
What should we know about that?
Diabetes in pregnancy. So it's not diabetes that you had before pregnancy, but the placenta in pregnancy can actually increase your risk for developing diabetes, which is a blood sugar kind of, mismanagement basically in the pregnancy. And some people don't know until their baby comes out really big, which can have complications, or people with gestational diabetes are also higher risk of developing preeclampsia and high blood pressure. Latina women are actually have higher risk of developing this in pregnancy.
Do we know why that is? There's no real science to back it up.
There's no real science. Same weight, the same other things that you bring into the pregnancy can actually just, it's like you can age match the same person, but the person who's Latina might have a higher risk.
Are there things you can do to prevent it?
Screening. Really it's screening. It has to do with having a normal weight and actually eating good foods and not eating a high level of sugar. But even if you do all of the right things, you can still develop it.
Happen. Okay, let's talk about the third thing, blood clots.
Blood clots, venous thrombosis. This is what actually Serena Williams had. So some people think of blood clots as the ones that come out of you, like if you're on your period, but the blood clots that are dangerous and life-threatening are blood clots that develop in the deep veins of the legs, and they can travel to the lungs, and that can actually put you at higher risk for death, really, because you can lose blood flow to vital organs.
I remember Serena Williams saying that she felt different, and she knew what it was because she diagnosed herself.
She had it before.
Is there like a symptom that women can look out for?
Shortness of breath is one. Really, really swollen legs. So not just like a little swelling. Every pregnant woman has a little swelling, but a significantly larger one leg than the other. Those are definitely increased risks.
Well, it sounds like no matter what, you should talk to your doctor if you suspect anything. And as you guys know, Dr. Wendy, she always she spits a sick rhyme. So she's about to rap for us today. We love when you come in with the song.
This is my little rendition of the Drake and Meek Mill song, Going Bad, but about pregnancy. Pregnancy's going good. We want it to go good. Okay. And we want you to think of prenatal care as a seatbelt, essentially.
Okay.
So let's hit the music. Yes, Dr. Every Woman. Once your baby's safely here, I know that's facts. Please remember prenatal care is the safest path. Insist if you ask me why it's safest, I give stats. See your OB so you can be healthy and relax. Test for diabetes, just to show her sugar's normal. Make sure you drink it all. I just want check her pressure, cause it all with the urine tells a story. Your pregnancy can change before you know it. Even if you're feeling fine, get in line, get prenatal care on time. It's important for the health of your baby, and you don't want to rely on a maybe. Not wearing that seatbelt doesn't equal safety.
I think that was my favorite of all of your raps.
Thank you.
You got her
every time.
Yeah. Her little vocals, she could sing a little bit.
Hey.
You can follow Dr. Wendy and read some of her latest blog posts on our site, dreverywoman.com. Can we get some of those raps on there too?